PPE stands for personal protective equipment. So usually in the home, we don't think about this at all. We might think about how do we prevent spreading germs, but we don't think about that PPE and what that means for me. That's something that's in the hospital. So if you have, you're dealing with someone that has germs or, infections that can spread, you might be asked to wear a gown or gloves or a mask or goggles. So the question now arises, if with COVID-19 in the community, should people be using these things at home? And we've gotten mixed messages over the past number of weeks, but a facial barrier of some kind, like a scarf, should be worn if you go outside, if you have to go do some errands, you have to go to the pharmacy, or if you have to go to the grocery store. That either can protect other people if you're potentially been exposed, and might offer some protection to you because this is spread by some droplets in the air. We don't know how well that works, but it certainly can be considered. You don't need to have these masks that they use in the hospital, although I know some people are using those. But a general barrier could be a good thing on the face. Gloves, if you're going grocery shopping or if you're going to a place where you have to pick things out, putting some simple gloves on. They don't need to be surgical gloves. They could be any kind of gloves. And then you take them off and you wash them when you get home, or if they're disposable, you throw them away and wash your hands. If you have someone in your home who's sick, they should be wearing a mask, and they should be, wearing gloves if they're touching, common areas, or you wear that and clean those areas between times as a way just to prevent the spread. So it's really barriers that you could do to prevent the spread. And there's one other thing I would mention is, if you have people that are coming into the home, maybe to help provide care for you or to help provide care for a loved one, they might actually bring like a gown or something to kind of cover their own clothes when they're in your home. Or if they don't, you could take like a shirt or something and ask them to put that on, over their clothes so that, the germs from outside are not coming in, or vice versa. Right? So that's another thing. It's not something that everybody needs to do, but if you're bringing people into the home to help provide care, particularly one-on-one close personal care, that's probably a pretty good idea too.